Hi, I'm Caitlin Blakeley, the inpatient post-lung transplant dietitian. This presentation will focus on nutrition recommendations in the post-lung transplant period. So as a quick overview, this presentation will review nutrition in the acute post-transplant period, long-term nutrition recommendations, and the dietitian's role, so you know what to expect in working with us after lung transplant. So first, we'll discuss nutrition in the acute post-transplant period. There are three major nutrition goals in the initial post-transplant period, including sufficient energy or calorie intake to help maintain your weight, optimal protein intake to help your body heal, and then lastly, adequate vitamin and mineral intake, which will also play a role with post-operative healing. From a calorie standpoint, calorie requirements are increased initially following surgery, and you may find you need to eat more than you were prior to transplant to maintain your weight. Calorie needs are highly variable and depend on the person and their post-operative course. They're determined based on your weight, your height, your age, your activity level while you're in the hospital, and then your stress level. Your stress level more so speaks to your body's metabolic stress or physical stress from the surgery itself. So why are your calorie requirements increased? Inflammation and stress related to surgery post-operatively can increase your calorie requirements, and you also need more to heal. The good news is that your calorie requirements for weight maintenance will start to decrease as your body recovers from surgery, and this usually takes several months depending on your post-operative course. Similar to calorie requirements, for protein requirements, your needs are increased following transplant. Protein requirements, again, they'll vary from person to person, but typically it is recommended to aim for at least 1.5 grams of protein per kilogram of your body weight. And in some cases, you may need up to 1.8 or 2 grams of protein per kilogram of your body weight. So why are your protein needs increased? Again, this is similar to calories, but surgery is associated with inflammation. And during this inflammatory response, your body may break down lean muscle mass to create energy. You'll also be on higher doses of corticosteroids, which can increase protein breakdown. And overall, your body just needs more protein to help you heal. As you recover from surgery and your corticosteroid dose starts to decrease, your protein requirements will also start to decrease. However, it's important to note that unlike calorie requirements, your protein requirements lifelong will be generally higher than the population because you'll be on chronic corticosteroids. So there can be a variety of barriers to eating following lung transplant. I've highlighted several here on the slide, but there are many more that you may experience during this time. So some might be feeling full quickly, and this can be related to the increased medication burden that you're experiencing. Some people experience gastrointestinal side effects like nausea and vomiting and constipation and diarrhea. And then some people develop dysphagia, which is defined as difficulty swallowing. So fortunately, if you're experiencing barriers to eating, there are a variety of strategies that can be helpful in optimizing your oral intake. I've highlighted two main ones here. However, in working with a dietitian after lung transplant, they'll work specifically with you to identify your specific barriers and tailor recommendations for your individualized needs. So one key strategy would be choosing energy-dense foods, which help maximize every bite of food. These types of foods tend to be higher in fat. So some examples are oil, nuts and nut butters, avocado and guacamole, and then hummus. This is a great way to increase your calorie intake without increasing the volume of food that you actually have to eat to meet your calorie needs. So in one example, if you measured a cup of spinach, this might only provide 20 calories. But if you measured a cup of diced avocado, this would provide nearly 240 calories. So you can see that with the same serving size, you're substantially increasing your calorie intake by choosing the avocado option. A second key strategy would be prioritizing protein, again, because this is what is going to help your body heal. So some examples would be your animal-based sources like chicken, fish, beef, eggs, and yogurt, your plant-based sources like nuts and nut butters, tofu, beans, and quinoa. And then there are several strategies to make sure you're getting enough protein in your diet, such as making sure that with every meal or snack you're eating, that you're including a protein-rich food. Also, when you're sitting down to eat a meal or snack, making sure you're eating the protein-rich food on your plate first, so you're filling up on that item that's going to give you the most benefit for healing. And then lastly, incorporating high protein liquid supplements or protein powders into your meals and snacks. And these will be provided to you at Brigham when you're admitted, and you can also use them at home after discharge. Some people find that eating 3 normal-sized meals a day can be burdensome and intimidating. So some people will combine these 2 key strategies and eat small, frequent meals that are energy-dense and protein-rich. So an example of this might be eating toast with some diced avocado and an egg for your protein. An alternative option, again, would be supplementing with liquid supplements that are high calorie and high protein as your mini meal. So what happens when you're unable to meet your needs through oral intake? There's an alternative mode of feeding, which is called tube feeding, that we can use in these circumstances. I want to start by saying that the need for tube feeds post-transplant is extremely common. The majority of people that I work with after transplant need a feeding tube, whether it be just for a couple of days right after surgery or for several weeks or months. However, it is really just a tool that is used to provide nutrition as a bridge to you being able to eat enough by mouth or the ability for you to safely eat. So some reasons why you might not be able to safely eat right after transplant is that some people develop dysphagia or difficulty swallowing. Other times, people have a breathing tube in place for a few days after surgery, and in that circumstance, it's not safe for you to swallow. And then in some circumstances, people are experiencing barriers to eating and they're not able to meet enough of their needs by mouth, despite making efforts to optimize their intake. So in this case, tube feeding would also be used. Tube feeding just involves the administration of a pre-made formula through a tube that is inserted into your gastrointestinal tract. This pre-made formula looks like a pre-made supplement like Ensure or Boost, but it is specifically designed to go through a feeding tube. And your dietitian will calculate your calorie, protein, vitamin, and mineral requirements to make sure that that formula is meeting 100% of your needs. And then a general question that I get from patients that I work with is that if you have a feeding tube, are you allowed to eat by mouth as well? So the answer is yes, as long as it is safe for you to swallow and eat per the medical team. So tube feeds can be used to meet 100% of your needs, but in some circumstances, you may be eating a diet and just not meeting enough of your needs, so we'll give you tube feeds to help supplement your intake. So there are 2 major types of tube feeding access. You have your short-term and your long-term. Your short-term is placed when we anticipate that you'll need tube feeds for less than 4 to 6 weeks. The tube is small and flexible. It can be inserted through your nose at the bedside, and it opens up into your stomach or your small intestine, which is where the majority of digestion and absorption occurs. And then it can be simply removed at the bedside once you no longer need it. Typically, these types of tubes are removed once you're on an oral diet and consistently meeting at least 60 to 75% of your needs by mouth. For long-term, these types of tubes are placed typically when we anticipate you'll need tube feeds for more than 4 to 6 weeks. It requires a minimally invasive procedure where the tube is placed directly into the stomach or your small intestine by the surgical team or gastroenterology. And then this tube, because it stays in place a little bit longer, it's a little less easy to remove. It's removed once you've demonstrated weight maintenance for a period of time without infusing tube feeds. So for visualization, I wanted to show you some of the different types of tube feeding access. So on the left-hand side, you have your short-term access where a small flexible tube is placed through the nose and opens up into your stomach or your small intestine. On the right side, you have 2 different types of long-term access. In the middle, you have the type of tube that's inserted directly into your stomach. And then all the way over on the right, you have the type of tube that is a little bit unique, but commonly used after lung transplant. So this type of tube has 2 different lumens, one that opens into your stomach for medication administration, and one that opens up into your small intestine for tube feeding administration. So now moving on to the long-term nutrition recommendations. So goals in the long term are more so focused on overall health promotion, including adequate calorie and protein intake to support your weight goals, whether that be weight maintenance, weight gain, or weight loss. It's also important to note that, as was mentioned on a prior slide, that your protein intake, your protein requirements are increased lifelong because of your chronic corticosteroid requirements. And therefore, lifelong, making sure you're getting in good sources of protein with every meal and snack is important. Secondly, preventing or managing post-transplant complications such as high blood sugar levels, high cholesterol levels is an additional goal. And then lastly, decreasing your risk of infection by following food safety guidelines. So following lung transplant, it's important to limit your salt intake. We recommend a moderate salt intake diet, which means that it's recommended for you to aim for less than 2,000 milligrams a day. And for just reference, 1 teaspoon of sodium contains about 2,300 milligrams. This is important because some of the medications that you're taking following lung transplant can increase your risk for fluid retention or swelling and can increase your blood pressure. Therefore, limiting your salt intake, which can also exacerbate your risk for high blood pressure and fluid retention, can be a helpful strategy to mitigate this risk. There are a variety of sources of salt in the diet. They fall into 2 major categories. You have your restaurant and packaged or processed foods like chips, microwavable popcorn, canned beans, canned vegetables. And then you have salt that you yourself add to food at the dinner table. There are many strategies to help decrease your sodium intake. And if you're someone that likes to add salt to your food or finds yourself eating more packaged and processed foods, it might be helpful to start integrating some of these practices into your lifestyle now so you feel more prepared after lung transplant. So you might flavor your food with alternative spices like basil, oregano, and paprika. You can use salt substitutes like Mrs. Dash. You can aim to choose foods that are labeled low sodium, and then reviewing the nutrition facts label. So I put an example on the right here in case this is unfamiliar to you, but when you're reviewing a nutrition facts label, it's important to first look at the sodium content itself. So here you see is 200 milligrams, and then look at the serving size, which is about 23 pieces. So if you imagine this is a bag of pretzels and you say, hey, I'm going to eat 2 servings today, that's 46 pieces. That's actually going to be supplying 400 milligrams, which is close to 25% of the daily amount that we recommend limiting your intake to during the day. So moving on to fat. Fat is a really important component of the diet and can be a helpful source of calories when you're struggling to eat or maintain your weight. It is not necessary to restrict your fat intake or follow a low-fat diet, but it is important to think about the type of fat that you're eating. Fat is the most calorically dense nutrient in the diet. It provides 9 calories per gram, whereas carbohydrate and protein provide 4 calories per gram. There are 2 broad classes of fats. You have your saturated fat, which are typically found in higher concentrations in animal-based foods like butter, cheese, fatty meats like bacon, cookies, and other dessert items. Your unsaturated fats are more commonly found in higher concentrations in plant-based foods like avocado, oils, nuts and nut butters, seeds, and then they can also be found in higher concentrations in fish. So this is important because some of the medications that you're taking after lung transplant can impact your heart health. And specifically, it can lead to increases in the type of cholesterol that can harm your heart, known as LDL or low density lipoprotein cholesterol. Following a diet that limits saturated fat intake to less than 10% of calories can help reduce the risk for elevated LDL cholesterol levels, and then substituting with unsaturated fats can help increase the type of cholesterol in your diet or in your body that benefits heart health, known as high density lipoprotein or HDL cholesterol. So when modifying your diet, there's some strategies to help decrease your saturated fat intake. These include using olive oil or sunflower oil when cooking instead of butter, choosing lean sources of meat and lower fat milk, so substituting whole milk for a 1% milk or skim milk, substituting cheese with low-fat cheese or food that's higher in unsaturated fat like avocado, or reading the nutrition facts labels for saturated fat content. So similar to fat, it is important to consume adequate carbohydrate, and you do not need to follow a low carbohydrate diet after lung transplant. Carbohydrates, also known as starches and sugars, are very important for your body because they're the primary fuel source for your brain and muscles. There are a variety of carbohydrates that you can get in the diet, including grains such as bread, rice, and pasta, starchy vegetables like potatoes, corn, and peas, fruit and fruit juice, and then added sugars. Added sugars are those that are not naturally present in food, but are added during the processing to help enhance the food's sweetness. So after lung transplant, you're at a higher risk for elevated blood sugar levels related to medications that you're taking. And carbohydrates can result in increasing your blood sugar levels after a meal. So it's important not to restrict your carbohydrate intake, but more so being mindful about the types of carbohydrates you're fueling your body with to help you better manage your increases in blood sugar levels. There are some strategies to do this, such as balancing carbohydrates with non-starchy vegetables, protein, and unsaturated fat. So for example, you could eat a sandwich with some peanut butter and maybe have a salad on the side, or a sandwich with chicken and a salad on the side. You could choose whole grains instead of eating refined grains, so choosing whole grain bread instead of white bread. And then lastly, limiting your intake of added sugar and reviewing the nutrition facts label for added sugar content. So moving on to vitamin and mineral supplementation, after transplant, we recommend taking a few different types of supplements. One is in the short term, and this is your daily multivitamin with minerals. So we recommend taking this at least for the first few months after surgery, because you have a higher demand for certain vitamins and minerals to help with healing. And this is even if you're eating 3 well-balanced meals a day and maintaining your weight. Lifelong, we recommend taking calcium with vitamin D to help promote your bone health. The chronic corticosteroid use can increase vitamin D turnover and decrease calcium absorption and overall impact your bones. For calcium, it's recommended to take at least 1,200 milligrams a day, both through diet and oral supplementation. So your best dietary sources of calcium would be really your dairy, but also fortified foods, so those that have calcium added to them, beans, nuts, green leafy vegetables, and then soy products. Vitamin D plays an important role in bone health because it actually helps your body absorb the calcium that you're eating. It is recommended that you consume around 600 international units per day just for maintenance. And the best source of vitamin D is sunlight. Unfortunately, if you live in the Northeast, you're likely not getting adequate sunlight to synthesize sufficient vitamin D. So oftentimes we need to rely on oral vitamin D supplements or choose fortified foods that have vitamin D in them, fatty fish, and eating cod liver oil. And then lastly, unless approved by transplant pharmacy, it is recommended that you avoid herbal supplements and over-the-counter nutritional products, as these may contain ingredients that can interact with your immunosuppressants and impact their efficacy. So lastly, for food safety, this is an important lifelong practice. Because you'll be on immunosuppressants lifelong, which can increase your risk for foodborne illness, these practices are intended to help mitigate that risk. So first and foremost, when you're handling any sort of raw beef, poultry, fish, or eggs, it's important that you wash your hands with warm soapy water before and after handling those items, as well as cleaning counters and cutting boards with bleach or bleach-containing products after handling those items. When you're defrosting frozen food, it is recommended that you do this in the microwave or the refrigerator instead of leaving it out on the counter overnight or putting it under running water, because that will increase the time that your food sits in this temperature range that's called the temperature danger zone. And that is where bacteria thrives and loves to grow. Fruits and vegetables are safe for you to eat raw or cooked, but it's just important that you're rinsing and washing them thoroughly before consuming them. Even if they're thick-skinned fruits like watermelon or avocado, we still recommend rinsing them thoroughly. And that's because the moment you cut into them, you're introducing the bacteria on the outside of the fruit into the part that you're eating. For beef, poultry, fish, and eggs, it is recommended that these items be cooked completely through. So for beef and poultry, this is at least 165 degrees Fahrenheit. For fish, this is at least 145 degrees Fahrenheit. And then for eggs, it means avoiding any sort of runny yolk. So avoiding your soft-boiled eggs and runny sunny-side-up eggs. For beverages and cheese, we just want them to be pasteurized. So avoiding all unpasteurized beverages and cheese. Pasteurization is a process by which that liquid is heated to very high temperatures to get rid of certain types of bacteria within them. And so when you're at the grocery store selecting these items, so for your milk, your juices like apple cider, and specifically your soft cheeses like brie cheese, blue cheese, and feta cheese, it's important to make sure they're clearly labeled as pasteurized. It is important to avoid eating from street vendors, deli counters, food trucks, buffets, and salad bars. And then lastly, prepackaged luncheon meats and hot dogs from a food safety standpoint are safe for you to eat. It just depends on how you prepare them. So prepackaged luncheon meat should be heated in the microwave for 15 to 20 seconds until they're steaming hot. And then hot dogs, even if they are purchased pre-cooked, it's important to reheat them in some capacity, whether it's in the microwave, on the stove, in the oven, or on the grill. So lastly, I wanted to review the role of the dietitian. So you know what it's like to work with us when you admit to the hospital and then after you discharge. So from the inpatient end, the main goal is to prevent malnutrition, which commonly occurs if you are experiencing any decreases in your oral intake, if you're experiencing unintentional weight loss within a specified period of time, and if you're experiencing fat and muscle losses. Typically in this setting, the inpatient dietitian will meet with you several times a week and will typically see you for anywhere between 5 and 20 minutes. We'll obtain information about your diet and weight history. We'll conduct nutrition-focused physical exams, and then we'll work with you to identify any barriers to eating and strategies to help optimize your oral intake. And then lastly, if you're unable to meet your needs through oral intake, we'll manage your tube feeds. In the outpatient setting, the focus is more so on disease prevention and health promotion. Because the acuity of your needs is a little bit lower, then the dietitian will meet with you less frequently, so maybe once a week, once a month, and even in some circumstances, once every few months. However, more time is spent with you each session, so it may be up to 45 minutes or an hour. The dietitian will work with you using motivational interviewing to help meet your nutrition goals through lifestyle and behavioral changes. And it's some examples of some things you might work on would be weight management, whether that be weight gain or weight loss, and then helping you decrease your cholesterol or blood sugar levels through dietary and lifestyle changes. So to summarize, in the immediate post-transplant period, there's an emphasis on adequate calorie intake for weight maintenance and protein intake to help promote healing. The inpatient dietitian will work with you to identify barriers to eating. They'll help develop strategies to optimize your oral intake, and they'll provide recommendations for tube feeds when your needs cannot be met through oral intake. Long-term nutrition recommendations are more so focused on health promotion and food safety practices to help decrease the risk for foodborne illness. Knowing this can all be very overwhelming, please know that a dietitian will work alongside you every step of the way. So thank you so much for your time. I look forward to working with you in the future.